Welcome to Save Your Money, Save Your Teeth. It's the go-to podcast where curiosity meets dentistry straight from the experts. I'm Jan, and every week I'm chatting to Dr. Clifford Yudelman from OptiSmile. We take a deep dive into the world of dental care from a consumer's perspective. And if you're looking to brighten that smile or protect your wallet, we've got you covered with practical advice and also the latest insights. So stick around, stay with us as we uncover the secrets to maintaining both your dental health and your finances. And we welcome back Dr. Clifford Yudelman once again as we continue our discussion on teeth whitening. Dr. Yudelman, welcome back.
Hi, Jan. Thanks. Great to be back and looking forward to another great podcast today. Some more information. It's episode number 4. And today we'll be talking about the risks of non-dental teeth whitening or teeth whitening that's not done in a dental practice by a registered dentist or hygienist. So should be interesting.
It really will be interesting. So I got to ask you, Doctor, what are the risks of getting your teeth whitened in, let's say, beauty salons or by non-dental professionals? What could possibly go wrong?
Okay, so from experience and from seeing or speaking to patients, the first thing I think that can go wrong is you can spend 800 Rand or 1,000 Rand and your teeth look white when you leave, and then a day later they're back where they started. And so this is save your money, save your teeth. So I think in a case like that, just rather save your money and get a proper registered dentist or registered hygienist to do it. So there's obviously different aspects we're going to look at today, but a non-dental professional may lack the proper training to apply whitening products safely. So when I say non-dental, if you get a person who's bought something on, I've seen it advertised on Alibaba or like from China or on eBay, where it's the proper hydrogen peroxide materials, but are very, maybe poorly controlled, poor quality, not one of the main name brands we've discussed, things like Flash, Opalescence, Polar, internationally recognized brands, just something generic. If it's a person that's applying hydrogen peroxide gels that they've bought over the internet, they are actually breaking the law. You're not allowed to do that. But aside from that, it takes a lot of training to do these things properly. So there could be a higher risk of gum irritation or chemical burns if the barriers aren't applied correctly, or if the light is not the proper light. If the light makes the teeth too hot, you could damage your nerves. You can get uneven results, which can be common. The products used, like we mentioned, might not be regulated or safe and can cause long-term damage. And without proper knowledge, it can lead to tooth sensitivity or enamel erosion. So that's if a beauty salon is illegally using hydrogen peroxide products or a non-dental person is using these. Some of the beauty salons have other products that they tout as does not contain hydrogen peroxide. It's all natural and it's got aloe and green tea, or you name it, some kind of natural ingredient. And that can lead to all kinds of other problems. The only thing that's been shown to bleach teeth properly are products that contain certain levels of hydrogen peroxide. So we're going to get into that a bit more in the next few questions.
Okay, and how effective are over-the-counter teeth whitening products when you compare it to professional treatments?
So again, I think we have to differentiate between something over-the-counter that you get at a dentist. So in this case, like at OptiSmile here by the front desk, we sell electric toothbrushes and a few boutique type items that are hard to find at pharmacies. So when you say over the counter, let's talk first about the ones that you can get from a dentist. So dentists are allowed to, and hygienists are allowed to dispense toothpastes and gels and whitening pens and whitening strips that contain hydrogen peroxide. So when I say dispense, it has to be prescribed. We don't let someone just walk in and purchase one of these products. They have to have their teeth checked. If you go back and listen to our previous podcast, you need to make sure that you don't have fillings or veneers or anything that's going to be damaged or that won't bleach. So the strength of the over-the-counter whitening agents will differ. They're obviously much lower concentration, and that the results are less predictable, with some people seeing little to no change. But now if we start talking about the ones that you would buy, say, at a pharmacy, at a Dis-Chem or a Clicks, if it says contains hydrogen peroxide or something else peroxide, so that they try and pull the wool over your eyes, these products are unregulated, and they're not allowed to sell anything with peroxide. So whatever you're getting in those is variable. Like I say, over the internet these days, you can buy pretty much anything. So one has to be careful with that. The professional treatments that we've spoken about before are custom tailored to your individual needs. So we spend a lot of time and effort. We take proper molds. We make whitening trays that fit perfectly to your teeth. We show you exactly how to dispense the gel, the right amount for your tooth. We've got about 4 different or 5 different concentrations and brands of different over-the-counter or take-home whitening bleachers or gels that we use with trays, and it's all very customized. You know, you get a take-home one that you buy at the chemist and you mold the tray yourself, and you don't know how much gel to put in. And to be honest, in the end, you might end up spending more than at the dentist. I'm not sure what other dentists charge. At OptiSmile, we charge about 2,000 Rand to do the impressions, make the models, do the trays, and fit your trays and show you how to do it. And then about 380 Rand per syringe of gel. Each syringe lasts about a week. So that gives you an idea of what you would be spending. Other dentists have different pricing structures, so you can call around or check. But like we mentioned in previous podcasts, you do need to start with a proper checkup and a cleaning. Trying to whiten teeth that have got, tea or coffee stains on top of them or tartar is just wasting your time and money.
Now, you always wonder what is inside these products. What are the most common ingredients in non-dental whitening products? And most importantly, are they safe?
Yeah, so they could contain things like baking soda or charcoal, but they can be very abrasive, like some of these whitening toothpastes or smokers' toothpastes. Like we said, some of the internet purchase products may contain unregulated chemicals. They haven't had the pH balance tested or adjusted. The ones that we use professionally have got products in them. They all have different things, but one of them in particular, called White Dental Beauty from the UK, has got something called Novon, which has been shown to strengthen your teeth. Some of the others have got desensitizers, so we customize it. Common ingredients would be to look out for if there's going to be any chance of it working, would be if it's got like very low concentrations of hydrogen peroxide or carbamide peroxide. The professional ones, we use a 7.5 or 9.5% hydrogen peroxide, which, funnily enough, is not available in the UK and some European countries. The most that they can use there is a 10% carbamide peroxide, which is only about 2 or 3% equivalent of hydrogen peroxide. Yeah, look, lower concentrations of peroxides may be safer for sensitive teeth, but less effective at removing stains. And the main thing is to check that it's been approved by Dental Association or by the ADA in America, or go on the website of the product and just see if it's some dodgy internet company or if it's actually a proper dental manufacturer.
Can these over-the-counter products actually cause damage to the teeth or gums?
Yes, so there's a number of published journal articles especially about erosion, or if the pH balance on the products, if the products are very acidic, or if you go to a beauty salon and they use something like an aloe vera or something and it's got citric acid, the acid will make your teeth look white when you finished, because it etches the teeth and gives them a frosty appearance, which makes them porous. And this isn't something you want, to happen to your teeth. A professional gel doesn't do that. If someone is using, so when we do in-chair whitening, we use a 35% hydrogen peroxide, which if it touches your gums, it can actually burn the gums. We make sure we cover the gums, like we mentioned in our, not the last one, but the podcast before, I think number 30, about in-chair whitening. That takes a lot of skill and training to make sure we use it properly. So if someone does have the 35% and they don't use it properly, that can cause very, very sore gums. We've seen that a lot. We've seen patients come in, and be wary of products that contain things like lemon juice and baking soda. They might sound natural, but they can still damage your teeth. Like, you wouldn't want to put vinegar in your eye. It's natural, but I don't think it's good for your eye. So, and always just follow the instructions that are given to you. Don't use them more frequently than what's recommended.
And how do internet purchased whitening products differ from those recommended by actual dentists?
So the one thing that really bugs me the most is they don't disclose the full ingredient list, and that could mean that there's harmful chemicals in them. Then there's also counterfeit products where they might say, opalescence or some popular name, and you get it and it's a counterfeit, and it doesn't have anything in it that's effective. They could be ineffective, but they could also be dangerous. You got to remember this: your teeth, you only get you get 3 sets of teeth: your baby teeth, your permanent teeth, and then the teeth that the dentist will give you when you get all your teeth pulled out, false teeth or implants. So you should look after the second set, because they're meant to be there for the rest of your life. It's like buying some dodgy eye drops online, or getting an asthma inhaler from Alibaba. I don't think people don't shop around for cheap knee replacements. They generally go. But we think with our teeth in our mouth, we treat it, people spend more on face creams than they would on teeth whitening, but they spend lots of money on that. And the best is to ask your dentist or your oral hygienist. Online products may promise instant results, but you could be very sorry in the long term.
Absolutely. So, Doctor, are there any regulations in place for teeth whitening products sold outside of dental practices?
Yeah, so in South Africa, this is regulated by a few different agencies. One of them that regulates all healthcare is the HPCSA, the Health Practitioners Council of South Africa. And there's something called scope. So a dental assistant is not allowed to place teeth whitening gel or block out on your gums. Only a dentist or a registered hygienist under the supervision of a dentist. So there's a lot of regulations as to the scope of practice, and obviously a beauty salon or a therapist can't register with the HPCSA because they're not health practitioners. And then there's regulations similar to the FDA, and I believe it's called SAPRA. The health, they regulate medications and chemicals that are used on someone's body, and they're very, very strict in South Africa. So all of these gels and products that a dentist purchases from a registered dental supply company have all gone through the proper regulations. And this is to protect the customer. I mean, there may be some dodgy dentists, what I call backstreet dentists in small towns that might be scamming their patients. You never know. They might be buying the same stuff as the beauty salons, from Alibaba or Temu or something like that. If you go on there, you can see they'll sell anything to anyone. You always want to just check the packaging. And as we said earlier, internet products often bypass the local regulations, which means you've got more chance of buying an unsafe item. Yeah, and the ones that, as we said also earlier, the beauty salon ones, they're in my opinion a complete scam, really.
And what should consumers be cautious of when they consider non-dental whitening treatments, apart from what you mentioned already?
So whether it's non-dental or even a dentist or a hygienist that promises instant or dramatic results with little effort, I think you have to be careful. We mentioned if you do a few sessions of in-chair whitening with proper products and the light and so on, and you don't use take-home trays, it's not going to be that dramatic. Check the actual ingredients, make sure that they're listed. I'd watch out for anything that's got citric acid in it. Make sure it's got proper instructions, or that it's always best for someone who knows what they're doing to give you custom instructions. I don't want to make it sound like it's more difficult than it is. We take it for granted. We do that all day, every day. We showing patients, your teeth are quite large. This is how much you should put. Oh, you got tiny teeth. This is how much you should put so that there's not too much gel. And I think, as we've said before, just always consult with the dentist first, especially even if you're going to use a non-dental product. Just go to your dentist first. Just make sure you don't have sensitive teeth or exposed gum lines or existing dental work. I'd love to see the dentist or the hygienist's face when you tell them you're going downstairs to the beauty salon to get your teeth white, and see what they say.
Yeah, I don't think they'll be very impressed. But Doctor, what is?
Yeah, and it's not even about the money. I think just we get to see the patients, afterwards with sensitivity or complaining that it didn't work, and then it's it's just I think it's buyer beware.
Exactly. And what are some of the risks associated with viral trends, like you mentioned, using lemon or baking soda to whiten your teeth?
So, look, lemon juice is highly acidic, and it will definitely erode your enamel. On some of our very early podcasts, we spoke about sensitivity, and other ones about diet. And I don't know if you remember, we were talking about anything with a pH, so 7 is neutral, and then 5.5 is already getting to the acidic side. Anything below 5.5 will erode your enamel irreparably. It will make your enamel, your teeth dissolve, and especially at the gum line. And lemon juice is right up there with battery acid. It's, it's down at about 2.5, I believe. When I was practicing in California, I was there for 16 years. And I know that when people drink tequila, they bite into lemons. And being right next to Mexico, there was a lot of tequila drinking, but also I saw a lot of Hispanic patients, and they just generally love sucking on limes and lemons, and the front teeth literally just melt away. And I've seen that in South Africa with people that eat a lot of citrus or naartjies. So you wouldn't want to intentionally go and put lemon juice directly on your teeth. And the same with baking soda. Is very abrasive. If you use it, it will wear down your enamel, and they could make your teeth look white temporarily, but this is just very short-lived. They could make your teeth much more susceptible to staining. And, if you don't have enamel protecting your teeth, then your teeth get more sensitive to hot and cold. And just because the method is popular online, that doesn't mean it's safe. You should consult a professional before trying it. So one other thing that seems popular is some kind of like purple stuff that you paint on your teeth, and that apparently makes your teeth look whiter. I think that comes from something I was looking recently, how you make a t-shirt white, and there's something called a bluing agent. So it's actually blue, and you put it, and it somehow makes your whites look more white. But go figure. I don't know much about that.
And I actually have a family member who swears by charcoal toothpaste. Can you discuss the effectiveness of charcoal toothpaste and other popular DIY methods, Doctor?
Yeah, so charcoal toothpaste may remove surface stains. So say if you drink a lot of tea, especially like rooibos or coffee or red wine, or you got some stains, on your teeth, using something abrasive like a charcoal toothpaste may temporarily polish these off more than a normal toothpaste, but I don't really recommend it because it can wear your teeth away using a very hard toothbrush or abrasive toothpaste long term. And then there's other things like turmeric and garlic, and these are just things that you see on TikTok and on Instagram. Looks, not all of them may damage your teeth, but I think you may be just wasting your time. And some of them that are harmful could harm your gums or your enamel. And, like I've said before, just rather check with your dentist because it's both safe and effective.
And finally, what should someone do if they experience adverse effects from a non-dental whitening product?
So stop using the product immediately to prevent further damage. Make use of common sense. Apparently, common sense isn't that common. Rinse your mouth with water and avoid using any other whitening products for a few days. If irritation or sensitivity is extreme or persists, then book an appointment with your dentist as soon as possible. The dentist may be able to prescribe something with calcium in it, or a fluoride treatment, or something that will rescue the eroded enamel, and or put desensitizers on your teeth, and maybe make you some trays that you can use some of these products in, just to get your teeth back to normal, and then recommend proper and effective products like we've mentioned.
And that's it for another edition of Save Your Money, Save Your Teeth. Dr. Yudelman, thank you so much once again. Very, very informative. And thank you for sharing your knowledge with us and for your time.
Thank you. And looking forward to speaking to you next week for our final teeth whitening episode 5 in the whitening series, with some great tips and advice. I know sometimes we repeat ourselves a little bit, but that's because not everyone listens to every podcast, and we're trying to keep people interested here. So thank you for today. I thought it was a great subject, because it's very common, and people are either wasting a lot of money out there and or putting themselves in danger that they're unaware of. So thank you very much, and I'll speak to you next week.
Absolutely. Thank you, Doctor. And also thanks to our listeners for joining us. Remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Then don't forget to subscribe to the podcast for more enlightening discussions, and then join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.